President Trump is ending the Great American Ripoff. That is, a drug can cost $1,300 in the U.S., and you go to London, and it's there on the shelf for $88. He's telling the companies you must lower your drug prices or there's going to be serious consequences.
The White House is touting new steps to try to slash drug prices, which could lead to billions of dollars in savings for Americans. It's the latest move by President Trump to try to address the cost of living and put more money back into Americans' pockets. In a Truth Social post, the president highlighted the sharp drop in drug prices and declared himself the affordability president. Dominick Tavella is the president and chief information officer at Lebenthal Global Advisors. He joins us now. Talk about the disparity that we just heard about from Dr. McCary, where a drug in this country costs $1,300 for a dose and it's less than $90 in Great Britain. How does that happen?
Well, first of all, let's start with it is true. Cost of drugs, American-produced drugs, American research drugs sold around the world, usually at substantially lower cost than they're sold here in the United States. The argument has always been that the drug companies need that extra money because they need to fund research and development for new drugs. And if they don't have this capital, they can't fund the research. So we have basically subsidized the entire world for research and development of these new drugs that we can use and the world can use. So there is quite an element of truth to that.
So why not spread the costs around among all consumers all around the globe?
And that's the argument here, right? So back in 2022, under the Biden administration, they agreed to finally go back to these drug companies and go, hey, we need to come up with a compromise here. So 10 drugs were negotiated back then, an additional 15 under the Trump administration, very aggressively going after these companies. And frankly, using a carrot and stick approach, and then next year, an additional 15 drugs. So this current administration very aggressively trying to lower prices. We know healthcare costs have been one of the largest inputs to inflation. Doing something like this is positive, but given the carrot stick approach to the drug companies, hey, we'll let you sell, we'll approve a lot more of these drugs, but you got to lower your prices, you got to make them competitive.
Yeah, it's not just drugs and healthcare. I mean, it's gasoline, it's groceries, just about everything is causing the affordability crisis in this country. Kelly Loeffler, the Small Business Administration chief, was on with Maria Bartiromo yesterday. Here's what she says the administration is trying to do. Listen.
President Trump has already deregulated to the tune of $2,000 per family, while putting about $700 of wages back in their pockets, forecasted to be about $1,200 by the end of January. So we are on track to see an economic renaissance in this country due to tax cuts, deregulation, fair trade, and we're already seeing it at the gas pump and at the Thanksgiving dinner table.
First of all, do you agree? I mean, more money in Americans' pockets. And secondly, if that is the case, they're going to go out and spend that money, right? That's going to lead to quite an economic boom in this country.
So let's talk about the first half of the question, John. And in part that kind of frustrates somebody like me, we are in a inflationary period. Now, that inflation now is down to 2-3%, but that just means costs have gone up by 2-3%, above what they went up last year, above what they went up the year before that. So for half of the Americans living in this country, they're struggling with fixed income, just trying to get basic needs done and paid for has been a difficult process. Now, if we can lower the rate that inflation goes up, that's a positive. Deflation is when prices actually go down. Now, we've seen that happen in energy and some other commodities out there, but overall cost of living today is higher than it was a year ago. Even if it's not dramatically higher, it's affecting at least dramatically half the population in this country.
President Trump is calling himself the affordability president and saying that a lot of the problem began in the Biden administration. It sounds like you would agree with that.
I have to, right? So we can look at something like energy, and energy prices have come way down. And that's a big component in inflation. Think about a Walmart that's shipping products across the country. Think about airlines that use energy. So energy is a really large input into overall cost of goods. That coming down is going to help a lot of people. It's going to help a lot of businesses control costs. But we still have to look at the big picture, and the big picture is costs are still going higher, even if they're not going as high as they were years ago.
I got to turn your attention very quickly to what's going on in Cook County. They have this basic income, universal basic income program. Here's how the Illinois Policy Institute sees it. They say Cook County is making its guaranteed income pilot permanent and committing millions to a failed strategy already shown to leave people with less work experience and lower earnings. A recent pilot program in northern Illinois, including Cook County, decreased workforce participation and lowered individual income before transfers. How do you see that program?
Well, they've run a couple of, and actually this has gone on across the country. I think I read there's over 100 of these pilot programs out there. What makes this very different than the old welfare programs is that there's no strings to the money. The individual can use it however they deem fit. And that's both a positive and a negative, right? So theoretically, they can still have a job and this supplements their income, but will it make it more difficult, their desire to go out and get a new job? It's questionable. So the total cost of these programs is not extraordinary. I think it really depends on the program itself, how disciplined they are about who they give the money to and how they control it and what that money is used for. Obviously, it should be used for good and not drug use or other things like that. But look, we have minimum quality of life standards in this country. If this program is controlled and used properly, we can see some good come out of it.
Dominick Tavella, Lebenthal Global Advisors. Dominick, thank you.
Thank you, John.